I always wanted to help people. And that's where you got your satisfaction in your job.
We all graduated from a university with that as our main goal, is the health and well-being of Canadians.
Qu'est-ce qui me rend fière d'être pharmacienne, c'est vraiment aider des gens.
At that time, most of us were independent pharmacies. It was a crawl, walk, run scenario. We were small with a limited budget and numbers, mostly owner-operators. My recollection is that we were being kind of railroaded, I use that word, by third-party payers. We needed somebody that would speak on our behalf and make them understand how serious some of their decisions that they took, the impact it had in dispensary operations. Met in Moncton, and Vic Robichaud was registrar and executive director. He wore two hats. That's what he'd always say. He'd sit there, I got two hats on. Vic helped us along with the structure and bylaws and mission and vision and all the other stuff that you need to get off the ground.
I attribute my involvement with the associations to Dr. David Young at Dalhousie University, because Dr. Young instilled in us from my first year university in 1983, you must be involved in your profession and you must be involved in your associations. It's self-regulated, and in order for a profession to stay the way you want it and evolve, you have to be front and center in that profession. So I've always taken that to heart and been involved in all my associations.
Community pharmacy is a business, but it's also healthcare. As a business, members are competitors with one another. But as members of the MBPA, we can join together as one voice to put forward our things that are important to us and work as one voice to improve and transform the practice of pharmacy for our patients so that we can provide better primary care.
I always felt we were never given the credit that we deserved as a healthcare professional. I think that's improved significantly here in the last number of years.
So over the years, the New Brunswick Pharmacists Association has always advocated for pharmacies and for pharmacists to fully use their scope of practice. You know, the scope of practice has been in place that we currently have since 2014. So we've always gone to bat for pharmacists to tell the government we can do these things.
Une des choses qui me surprit au niveau de l'association, c'était le temps qu'ils mettent à discuter avec les politiciens. Puis finalement, des fois, des projets qui nous prennent, mon Dieu Seigneur, la chose qui me surprit, les affections urinaires.
If you look at the wins that we've had in New Brunswick and just in the last 2 years, they've been significant. And it might appear that we've come a long way in 2 years. Well, that has been a decade or more of work.
Pharmacists have always been seen as purveyors of a product. They're producing a prescription. And pharmacists, I believe, in the future will move into more clinical roles. We'll always need a pharmacist at a pharmacy, but will they always be in the dispensary preparing prescriptions? We'll see them more often in a clinical space, seeing patients and providing primary care.
When we first get the scope, that's the first smile. Then when you are able to get paid so that it is sustainable, you can offer it to everybody, and there's not someone at your counter thinking that they can't afford, the service. That's an even bigger smile because you know that everybody can now access it and you're truly contributing to the health and well-being of New Brunswickers.
The pandemic has raised our profile significantly. And I think the public now realize exactly more so than before what we're capable of doing when it comes to their health.
Pharmacists have risen to the occasion the last 2 years. The amount of work that they put into being on the front line when everything else shut down, everything else went virtual, they've been there. Staff was going short. The pharmacists kept showing up.
On s'est impliqué, on a mis des heures, puis on a de l'énergie, puis ça paraît, puis on a prouvé aux gens qu'on est là, puis on est là pour répondre aux besoins de la clientèle, des patients du Nouveau-Brunswick. Puis je pense qu'il faut profiter de ce moment-là, puis pouvoir aller de l'avant, puis prouver encore plus comment on est bon, puis continuer à faire d'autres services, puis continuer à s'avancer dans notre profession par rapport à ça.
Although the pandemic really helped the public see what pharmacists can do, it was a lot of work of the volunteers at the New Brunswick Pharmacists Association, the staff at the New Brunswick Pharmacists Association, that really helped move those things along. And without a strong membership of engaged members, we wouldn't necessarily have been able to do that.
There's strength in numbers. And if you aren't part of something, to argue a case on your own, you just don't have a chance. You need to be part of something bigger.
I am most proud of the fact that the association's been able to do it. That when you compare them to some of the bigger associations and when I work on a national level, they really do punch above their weight.
40 years remarkable. And the next 40 will be more remarkable, so congratulations to everyone that's volunteered the last 40 years.
Bonne fête à la gang de fous qui ont décidé de commencer ça, une association des pharmaciens, puis de faire qu'est-ce qu'on est maintenant. Puis cheers à tout le monde qui s'est impliqué, qui travaille plus ou qui travaille, à nos caissières, à nos pharmaciens, à nos techniciens, à nos assistants. Bravo, puis je nous souhaite un autre 40 ans.
40 years, went by in a blink of an eye. I congratulate all pharmacists on having a very successful 40 years, and I really look forward to another 40 more and many successes in the future.